Hello, everyone, and welcome to our Maternal and Child Health Special Topics webinar. So happy to see so many of you able to join us today and register for this webinar. We will get started. My name is Mary Lizakowski, and I am a Coalition Health Director with Foundation for Healthy North Dakota. It is a nonprofit organization established in 2022 with the mission to promote health and wellness across North Dakota by working at the community level. We continue to expand our statewide coalition to foster collaboration among local communities and on common initiatives. By becoming a member of the coalition, you'll be the first to receive information on educational opportunities like this one, updates on relevant public health information, legislative news, as well as access to digital advocacy resources and toolkits. Just a few housekeeping things to cover before we get started. Webinar attendees will be automatically muted for the presentation. If you have questions, please put them in the chat box, and we will cover the questions during the Q&A session. We are recording this presentation, and a recording will be sent out after, along with an evaluation survey to complete. It is my pleasure to introduce our presenters today. The first is Dr. Maridee Shogren, who is the Dean and a clinical professor at the University of North Dakota College of Nursing and Professional Disciplines. She is also a certified nurse midwife and certified lactation counselor who has practiced women's health, obstetrics, and family planning in a variety of settings. Dr. Shogren has been involved in SAMHSA-funded grant work since 2014, spending 3 years on an interprofessional SBIRT training grant, and currently working with the Region 8 Mountain Plains Addiction Technology Transfer Center and the Mountain Plains Mental Health Technology Transfer Center Network. Dr. Shogren served as the principal investigator on the Foundation for Opioid Response Efforts grant-funded program, Don't Quit the Quit, from 2020 to 2024, where she worked to increase access to treatment and care, enhance community education about substance use disorders, and grow community awareness and support for people who are pregnant or postpartum and in recovery from opioid use disorder. The Don't Quit the Quit program was privileged to provide training for many WIC agencies across the Midwest during the grant period. This led to a long-standing relationship with the USDA WIC. In September 2024, Dr. Shogren and Dr. Rachel Navarro were awarded the Substance Use Prevention Education WIC Award. This UND team will be developing national training for WIC agencies and revising the WIC Substance Use Prevention Guide. Dr. Shogren's areas of expertise include SBIRT, SBIRS for general populations as well as pregnant and postpartum people, some substance-exposed mothers, peripartum depression, and stigma and substance use disorders. Thank you for joining us. Our next presenter is Amanda Woehl. She has been with Healthy Families for almost 3 years. She has a degree and background in nursing as an in-home childcare provider. Her passion has always been caring for others. As a wife and mother who worked hard to break the cycle of generational trauma for her 11-year-old son, she pours her heart into her work with families and loves HFA's strength-based focus and helping families realize they have all the tools they need to be successful in their parenting journey within themselves and their communities. So thank you so much for joining us today, and I will turn it over to Dr. Shogren to get us started. They have all the tools they need to be successful in their parenting journey within themselves and their communities. So it's a pleasure to have you both here, and I will turn it over to Dr. Shogren to start us off.
Okay. There we go. So let me pull slides up here. All right. Can you just confirm, Mary, that we see everything? Okay.
I sure
All right. Thank you so much for having me be with you all today. I can't see who's all in the audience, but I am going to hope that at some point I probably crossed paths with some of you that are out there just because of the previous work that we had done. So as Mary shared with you, we have a new grant. It's actually a collaborative agreement that we have with the USDA Food and Nutrition Services Department, and we're just really getting started with that work. So I don't have kind of a heavy didactic or learning presentation for you all today, as we're still trying to figure out what that curriculum is going to look like. But I am loving the opportunity to share with you what is to come and kind of why we've decided that really working with community-based organizations is just a great thing for maternal health care. So with that, I'll go ahead and get started. There we go. So Mary talked a little bit about the previous grant, but this is really the grant that kind of kicked everything off for us to do this work with WIC. So back in 2020, actually 1 month before we all got sent home for COVID, we were awarded a grant at UND to start working with the Don't Quit the Quit program. And this program was very much focused on opioid use disorder. We had three aims of this grant, and the first was for us to work on increasing access to the number of healthcare providers who would prescribe medications for people with opioid use disorder. Since that grant got started, now people don't have to go through the lengthy waiver process and education training that was required back at that time. So we really tried to make a little bit of a dent of that in North Dakota. And then we had an arm that was going to be focused on education. And for education, we looked at very broad opportunities, not only for families who are impacted by opioid use disorder and wanting to provide them with additional education through the form of free monthly webinars, but we also set out to try to tackle stigma, the stigma that especially surrounded people in the perinatal period with substance use disorders, and really made sure that our education included that topic and that discussion. And then the third part of our education aim was to work with our North Dakota WIC agencies and provide training for them. That is the part that I am excited to share with you in a little bit about all that we were able to accomplish with our North Dakota champions. And it just became an area of the grant that was near and dear to my heart, and just couldn't wait to continue that work. The third aim of Don't Quit the Quit was to increase postpartum community support, and that we were trying to grow the number of postpartum doulas who actually served our families in North Dakota. I will tell you that that part was a little bit more difficult for us to get rolling, but by the time we got to the end of the grant, we had successfully supported 10 people in our state to go through that training to become postpartum doulas. So what we really discovered through the course of this work was something that I knew, but I didn't know. And what I mean by that is that working for many years as a certified nurse midwife, I often referred families to WIC. I shared resources with them, said, please contact them, let's work with them during your pregnancy. And I did that with a basic understanding of WIC, but really through the course of Don't Quit the Quit, came to know them at such a deeper level and really appreciate all that they are able to do for our families. They're actually very vitally important to the ongoing care that people with substance use disorders need. We do have to consider them part of an interprofessional team, and we don't always talk about that in practice. It's kind of that referral source, but we don't really integrate them into the team approach that we should have in maternal health care. They're able to provide many kinds of community education, and they actually become a very key point of referral. So this is an organization that has access to other community partners. They're well in tune with their local community resources and have that knowledge to be able to share those referrals to families. They can connect them with social services. They can help them find areas of substance use counseling and treatment. They might have access to referrals to behavioral health, and they just have a number of other good community resources that they can share. One of the things in particular that I think we often overlook is that they actually have the opportunity to fill a gap in the continuity of prenatal care. And then this means especially in the postpartum period. And what I mean by that is that we often we encourage moms to access WIC when they're newly pregnant and help them work through their pregnancy with nutritional support. But what we learned was that many, many people who have just had babies, 40%, do not return to their obstetric provider for even one postpartum visit. And that's even lower for minority and underserved women. So after delivery, Sometimes moms just go right into mom mode and they put their health last. They make sure newborns are getting their care, their family is accessing care, but they sometimes don't continue that closure of that perinatal care and actually seek out healthcare in that entire first year postpartum. Many moms will lose their health insurance after 6 to 8 weeks postpartum, and they might have some inconsistency with providers. So for the course of their pregnancy, they might have been seeing an obstetric provider, and now they have to reaccess and get back into primary care. And sometimes when they're in the process of doing that, they just forget to establish that care. But we have learned from our partners that many of them will continue to engage in WIC. They will follow up with those appointments, especially if they have established a really nice relationship in the prenatal period. So WIC support for people with substance use disorders actually helps moms maintain their recovery. It helps them influence their ability so that they don't return to use. They have another area of support. They continue to provide nutritional support that is crucial to their sustained recovery, as well as while they are breastfeeding, if they choose to do so while they're in treatment. And WIC is able to provide acceptance and non-biased care that helps us continue to break down this stigmatizing message that we often experience in our communities. So with that work that we were able to do through Don't Quit the Quit, we actually, just to kind of give you an idea of how this became the most successful part of that grant, is that we started out our training in 8 rural North Dakota counties. And by the time we finished, we'd expanded North Dakota training alone to 12 counties in our state. Our webinars became accessible through Train North Dakota, as well as freely accessed on our website. And we had over 800 people who visited those webinars. And our most popular webinar happened to be the one that we used to start our training with WIC agencies. We had the opportunity to present to the National WIC Association, as well as the National Indigenous and Native American WIC Coalition twice. Those were delightful opportunities. We collaborated with both SAMHSA and HRSA and expanded extended training to South Dakota, Idaho, Texas, Missouri, and throughout regions 7 and 8 in the SAMHSA area. And we collaborated with HRSA in particular to offer trainings to federally qualified health centers and their clinics and WIC agencies that were in tribal nations. Once that all got completed, none of us wanted to see it end. And so we really we continued that dialogue with the USDA in particular, and talked about maybe how we could work together to expand that training even farther out nationwide. And so we were able to come to a collaborative agreement that Mary mentioned that we signed in September of 24. And this agreement is a collaboration not only between the College of Nursing and Professional Disciplines, but with the College of Education and Human Development at the University of North Dakota. And we will be working with the USDA over about a 3-year grant period to conduct training and education for WIC agencies all across the United States. The objectives of this agreement are to deliver trainings in person and virtually, and in some cases even hybrid, to WIC programs to support their staff who provide substance use information and referral to WIC participants. We will work with them to revise the substance use prevention, screening, education, or referral source guide that's available for local WIC agencies. And so this is an opportunity to help them update materials and have them be readily accessible to all WIC agencies. We'll work on developing some online training, create some patient handouts, and then work with our USDA Food and Nutrition Services on recommendations for those WIC agencies. While we haven't completed what that curriculum looks like yet, I can share with you the topics that we will be talking about, and that will provide some basic substance use disorder education. We'll talk about the impact of different substances during pregnancy and the effect that they may have on lactation. We'll work with WIC staff on approaches to how you can screen for substance use in the perinatal period and introduce screening tools that might be a good fit for their agencies. When we had started this work in North Dakota, they championed an approach that we decided to call starters and prompts. And that means that we helped North Dakota WIC agencies create a conversation starter. So when you screen somebody for substance use, if that happens to be a positive screen, how do you start having that conversation to talk about where you can go to get care, what the impact of substance use might be, and how do you share that information not only with the mom who's in your office, but expand that education out to the families. And then we really loved diving into something that we called Mom Talk. And so we learned that one of the gifts we have to do this work is to take what's in the evidence, what's in the literature, and use that information to create a layperson terminology or conversation so that everybody has a better understanding of substance use. So we'll incorporate tools like that. We'll work on different brief interventions that WIC staff can use in their engagements with participants. We'll also do a brief introduction to perinatal mental health concerns. We learned a lot from our partners in South Dakota, WIC agencies and public health agencies, about the work that they were doing to incorporate screening for perinatal mental health. And so we're going to try to translate some of that work into this type of training as well. As many of you know, people with substance use disorders often have many other comorbidities, many of which include perinatal mental health concerns. So we want to talk about them together as we work to grow healthy families. And of course, we'll continue to talk about the stigma that surrounds perinatal substance use disorders. So really what we're advocating for, and I hope that you will all consider, is this idea that we expand beyond traditional prenatal care to include a community-based approach to maternal health care. So this means that we are looking at person-centered care delivered in communities that emphasizes prevention and health promotion. And we can think of really no greater partners than WIC as an example of this. Nationally, there is a call for everybody to do this work, and it includes prevention-based education, not only for families, but also for our providers. So that means the people who are working in community-based agencies, it means people who are healthcare providers like nurse midwives and physicians and nurse practitioners, all of us wanting to have more stake in taking a community-based approach to this type of education. We know that WIC continues to address many public health issues. One of the first that comes to mind is, of course, nutrition issues that are there. But perinatal substance use has quickly escalated to become a very significant public health concern. And we have a need for overall training for many, many different types of community partners. We need to address the concerns that surround drug and alcohol use during pregnancy. And we need to recognize that maternal substance use affects the entire family. And so we want to grow healthy families during this work. And we want to encourage women to seek out supportive services and connect them to different treatment options. I think it's always helpful to have a little bit of a background. Sometimes people will say, well, this work's been going on for a long time. Is it really still a problem? And it is. It is something that we do have to continue to address and keep at the forefront of maternal health care. We know that the National Survey on Drug Use and Health, who puts out annual survey results for drug use in the United States, has indicated that over 21 million females in the United States do continue to report substance use disorders. Among those females, those who are aged 18 to 25 are most likely to develop a substance use disorder. And that means that women are really at the highest risk for substance use disorders during their reproductive years. And I think any of us who have been moms, know moms, we know that it's a period of time that's always full of change, lots of juggling that happens, and sometimes self-care doesn't end up being top of that list. And so we want to be able to continue to reach out specifically to this population of women. Tobacco, alcohol, marijuana, cocaine, and opioids are the most frequently used substances during the perinatal period. And we've seen increased rates of opioid use, cannabis, and stimulant use in pregnancy over the past 10 years. So this isn't changing. It still continues to need our attention through trainings like this that we're creating. Despite all of these statistics, we also know that substance use in pregnant and parenting people is underdiagnosed and it's undertreated. And a lot of this can be directly related to a misunderstanding regarding substance use during pregnancy and misinformation that still continues to circulate out there. We also know that, as I mentioned, there are many comorbidities that go along with substance use disorders, not just in perinatal people, but across the board. However, when we have a combination of comorbidities, substance use disorders, and mental health concerns, we know that we see significant disparities, especially in our rural areas. Underserved communities, those who have challenges with access to healthcare have increased rates of substance use disorders, and we see those constant challenges that are attached to stigma. So we really believe that we can't do this work without addressing the stigma that comes along with substance use disorders. So finally, we really believe that healthcare would be remiss if we didn't include community partners. And so I urge everybody to think about the local resources that are in their communities, the partners that they maybe haven't thought about collaborating with to be able to share this work and tackle maternal health care in a very nice population-focused approach to be able to do this. We think that WIC is very well positioned to do this work, and we think that they haven't received enough acknowledgement and attention to the strong role that they play in maternal health care. So we are incredibly honored to do this work along with WIC, and I hope you all will stay tuned as we develop this curriculum and start providing these national trainings all across the United States. So I thank you very much for your time today.
Thank you, and for sharing the wonderful work that you're doing. Amanda, I will turn it over to you.
Great, thank you. So my name is Amanda, and I work with Healthy Families. We are so thankful to be given this opportunity today to share about our program and the work that we're doing in communities across the state, especially with families struggling with incarceration and substance use disorders. A little background on Healthy Families. Healthy Families is a home visiting program that was first started in 2000 and housed under LSS, or Lutheran Social Services of North Dakota. The first Healthy Families location was in Grand Forks. In 2009, Healthy Families opened another site in Bismarck, and 10 years later, the program was expanded to Dickinson and Wofford City. In 2021, Lutheran Social Services closed, and it kind of left the future of Healthy Families uncertain. With a lot of hard work and dedication of some great people, Aspire ND was created and began to house the Healthy Families program. We are very proud and thankful to say that as of 2024, we have expanded and now serve all 53 counties in North Dakota. In 2024, we had just under 4,000 home visits with just over 300 families across the state. So who we serve, our services are free and to all participants, and we serve families in all income levels. There's no income requirements for families. Our program is completely voluntary, so families are in control and always have the choice to participate or end services. We work with families prenatally through 3 years of age, or for up to 3 years from their date of enrollment for those families who may be enrolled after baby is born. We serve families of all backgrounds and demographics. Some of these include families with CPS involvement, incarceration, substance use disorders, and mental health concerns. You can see in the graph on the left-hand side of the screen where some of our visits take place. We work really hard to try to have in-person visits with families, oftentimes in their home, but we also can meet with them at our offices, at the park, a coffee shop, really wherever the family is comfortable. And for continuity of services and breaking down some of those barriers, we do also offer phone or video visits for families if needed. During families' time in the program, services we work really hard to make sure that we have staff work long-term with families and focus on building a trusting and respectful relationship. We know that oftentimes families are being very vulnerable and letting us into their home, their lives, and most importantly, their child's life. During home visits, which are weekly for about an hour to begin with the program, we work side along families to help them find and realize their strengths. Some of the ways that we support families include making referrals to different community resources, including WIC, SNAP, parent groups, community events, peer support services, early intervention services, and really just take time to make sure that we're giving them referrals to fit where they're at in their life and what their needs are. We work with families on goal setting, which we'll talk a little bit more about later on. We do screenings. We are lactation certified and car seat safety certified, so we are able to help with breastfeeding support, car seat installation, and car seat safety checks. We use evidence-based curriculum and activities to help support parent and child attachment. And then we are a Cribs for Kids provider, so we can offer those safe sleep education for families. Some screenings that we do with all families include developmental screenings, substance use screenings, depression and anxiety screenings, parenting inventories, which break down many different areas of parenting, and relationship assessments. Based on the results of some of those screenings, we can see the many different areas in this graph of different areas we're able to help support families in setting goals. So when serving families who are dealing with incarceration, we again focus on helping parents to find their strengths, grow in areas of risk, and work to help strengthen that parent-child interaction, as well as educate parents around child development and milestones. Some of the resources that we use with incarcerated families include assist screenings. Assist screenings were developed by the World Health Organization, and it allows us to screen for many different types of substance use, from alcohol and marijuana to opioids and amphetamines. This screening helps us to identify past or present substance use, and based on the scores in each area, it helps us highlight areas of risks and strengths and helps us guide conversations with families to provide resources. Goal planning, again, something that we work really hard with all families on throughout their entire time in the program. Families can set short or long-term goals. The important things that we look for when setting goals with families are that the families are the ones setting the goal. We're not setting it for them. The goals are meaningful, measurable, and can be broken into smaller steps to feel more attainable. We feel like it's important to support and celebrate the smaller steps along the way to help build confidence and offer support leading up to the overall goal accomplishment. When a goal is achieved, we always celebrate that achievement with the family. If a goal is not achieved, we help look at what the barriers were, normalize around the feelings that the parents may have around that, and then help them focus on how we can move forward. For our incarcerated families, we also create transition plans. In making these transition plans, things that we include are making sure that the family has contact information for their family support specialist. We make sure they have our phone number, our email, they know they can call or text us, and oftentimes we include the information for our supervisor as well. We also like to make sure that we have contact information and releases of information for the family's caseworker, for a family member or support person in case we can't contact that parent. We want to really eliminate that barrier of not being able to continue services with the family. We include information on the transition plans for things that families will need to be successful upon their release from prison, such as information on local NA or AA meetings, transportation resources, local food pantry locations, WIC and SNAP information, local housing resources, often including felon-friendly landlords or properties, information for places in the community where they might be able to get household or clothing items, And then the important thing also with the transition planning is that we try to pre-schedule set days and times that we're going to be visiting with the family. So again, that we can ensure that continuity of services when they're released. For birth planning, we worked really hard at Healthy Families to create a community birth plan. And in doing that, we also wanted to make sure that was something that we could offer to our incarcerated families. We created separate birth plans for moms depending on where they're incarcerated. For example, if a mom is incarcerated at the women's prison, she may have different options than a mom incarcerated at HRCC. So we wanted to make sure that they had a plan that fit the needs and the allowances of the options that they have for where they are. The birth plans are not us giving any medical advice or information. They're really meant to empower moms and to encourage them in having conversations with their provider, their caseworker, and the prison staff who will be present with them for the birth. We do Edinburgh depression screenings, both prenatally and after birth. We want to make sure that moms feel supported postpartum and that if we have any concerns, we're able to communicate that with case managers. We also offer curriculum and resources to help support the moms. In supporting visitation with the children, we make sure that we have releases of information for the support persons or case manager. We will often set up a virtual visit with that case manager or the support person who has the child so that we can make sure we can see that parent-child interaction and that we are helping break the barrier and give families the opportunity to see their children. We, for in-person visits, offer activities and provide tools to help support parent-child interaction. And then having conversations and educating parents around child development, positive parenting, just to help give parents confidence during those interactions. Again, we're lactation certified, so we're able to offer education and support around pumping and breastfeeding for those moms who are choosing to do so. Some examples of things we've done in the past to help support moms are talking to them about having a photo of baby with them while they're pumping. We've helped moms with latch support while in the hospital and during visitations, and then help to make sure mom's frozen milk is able to get from the prison to the support person or case manager. We also use curriculum to support incarcerated families. Some of our curriculum is Hope at Home, which is a curriculum that helps with growing relationships, resiliency, self-care, and coping skills. And then our Living the Protective Factors curriculum, we think as parents, we're always thinking about those inside influences and how to keep, or outside influences, sorry, on how to keep our children safe. So like environmental things, stranger danger, those kinds of things. Living the Protective Factors focuses on the inside influences and really helps to prevent those ACEs or adverse childhood events and breaks down the 5 protective factors that are the building blocks of parenting. Support with families with substance use disorder looks similar to those with who are incarcerated, with a few key differences. The main differences are that we're able to make referrals for mental health resources and referrals for treatment. We are able to invite those parents to parent groups. If the parent does not have custody of the child, we try to coordinate those with the case manager or support person so that parents can have that time with children. And then referrals for community events or support groups. Again, the curriculum that we use, we have that Hope at Home curriculum is specifically designed to support families with substance use disorders. There are modules specifically to educate around relapse and warning signs and triggers. And then safety planning. We know at Healthy Families that addiction is a disease and that oftentimes relapse is a part of recovery. If families are going to be using substances, we want to make sure that we're safety planning with that family to ensure that the child is safe if the parent's going to be using. Healthy families, we know that parenting does not come with an instruction manual. That can feel really intimidating and heavy at times for all parents. Parenting can be especially stressful and triggering for families who are facing incarceration or substance use disorders. I'm sure we've all heard the saying that it takes a village, and it truly does. Many of the families that we serve have limited supports, and we want to be their village and give them the tools that they need to grow their support networks and their confidence in healthy ways. Families who have participated in our program have reported having more confidence in themselves as parents, were able to create more positive parent-child interactions, and did more to promote healthier child development. Parents also used more positive discipline, less yelling, and less physical punishment. And one amazing way that children involved in the Healthy Families program have benefited are by having less adverse childhood events, such as physical abuse and neglect. We're truly able to help families break the chains of generational traumas. Our program would not be successful if it weren't for our community partners. One of the best ways to support our program is by making referrals and setting families up for success. There are multiple ways to make a referral to our program, but one of the easiest ways is just by visiting our website. From there, you can click the Healthy Families tab at the top of the screen, fill in a quick few areas of information, and submit it. From there, we get the referral, and we make sure that we are connecting with that family to offer services. I truly, truly love Healthy Families and the mission that we stand for, and I could talk for hours about how passionate I and the rest of our amazing team are about the work that we do. But I feel like the best way to show how great of an impact the program has is to hear it directly from one of the families that we've been so blessed to be able to support.
Hi, it's Drew Lunday, and I'd like to share my story and how I got connected with Healthy Families and how it helped me. I came from a family where, you felt like a burden. There was no love within the family. We weren't connected as a family, and there was no support for one another. Most of my family suffered with substance abuse, including myself. Growing up, I always felt alone, always secluded myself to my room. I never had any true support from any family. When I was about 18 years old, I started experimenting with other drugs. I started to lose myself. In 2016, I found out I was pregnant with my first child. I got sober and started my journey of motherhood. I skip forward to the year of 2022. I had 4 children by this time, was pregnant with my 5th child. I was taking care of my 4 children the best I could with only the support of my significant other, who was deep into a very serious opioid addiction. He had many people come over, and one day one of his friends came over, and I was in need of escape from all my depression and my anxiety and my resentment towards my significant other and just taking care of children by myself. And I started using a substance that I never thought or had ever used before. It relieved my stress, gave me energy to get things done. I didn't have what most people see with fentanyl use. I had energy. I wasn't drowning out. It was like an antidepressant for me. I noticed how it became very addictive. I was very dependent on it. If I didn't use it, I would end up getting sick. I could not get out of bed. It was impossible to take care of my children. I ended up losing myself amid my addiction. And then I found out I was pregnant with a little girl. And then I started on my journey of finding myself again. My significant other got pulled over and ended up getting in trouble with the law with our charge, having children in the car and paraphernalia. We lost our children to the system due to the struggle of drug abuse, and my biggest fear was losing my daughter after she was born. I then started to focus on my sobriety. I started taking medication to help with withdrawals and cravings. I started to work with Child Protective Services to get my children back. And with my CPS worker, social worker, I was offered help from an agency called Healthy Families. Now with Healthy Families, I received support from a family support specialist. She came in once a week. She sat with me for an hour and just listened to me and gave me ideas and things I could do with my children, and developmental screenings to let me know where they were at with their milestones. He also listened to all the struggles I was going through without being judgmental, but also the presence she gave and never judging me and letting me know I wasn't alone. Because of Healthy Families, I was able to have visitations with my children, and within a month, I had my children come back one by one. My significant other and I decided to give our new baby girl the name Serenity, but under one condition. We both had to be sober. After getting all of my children back, we were still working with Healthy Families, talking about morals, talking about our values and how we can work on them and make our family better, healthier, and stronger. We talk about mine and my significant other's relationships and the days I have bad days and feel known that I can lean on them and reach out. They help me to see positive within the negative. Not only that, but they do things with the community to help you get out, be social, enjoy the outdoors. If it wasn't for my family support specialist this summer, I definitely would not have gone to the park as much as I needed to. I appreciate all the help, support, and love I've received from Healthy Families. I hope more families learn and know that it takes a village to raise your children, that it is okay to ask for help. And if you need help, Healthy Families is there. I'll say thank you, especially to the ladies who helped this support. Thank you so much. Thank you.
We are incredibly thankful to Drew and Dylan for allowing us to share their story with others. And we hope that we are able to make an impact in many more families' lives as we're offering services throughout this state. We have a Facebook page that we would love if everyone wanted to follow. We just do some fun posts. We celebrate families graduating the program and any fun things going on within the program. Thank you all so much for taking time to listen and learn more about the program and the work that we are doing.
Awesome. Wow, what a powerful story. All the feels right now. Thank you for sharing. I am going to put my screen back up and we can go into questions. And I will put also a QR code up in case anyone wants to take this survey. But while we're moving into questions, one person asked, I believe it must be for the link to to that video maybe, or I'm not sure. Lori, could you share the link so I can share it with my OB providers? Are you referring to the video link? I'm not sure. We'll see, but I'm sure I can get it from your slides. So one question that did come in during registration was any specific info and data related to tribal nations and indigenous people. And I don't know, maybe would that be for you, Dr. Shogren?
Is the question looking at statistics of use?
I am not sure that's all that it has on there. So I'm just trying to
Yeah.
kind of think of what it could be about.
Yeah, the information that I shared today was just more of a general look of the statistics that come out of the National Survey on Drug Use and Health. They used to break down populations a little bit differently than the most current surveys do. We do know that our tribal communities have been very engaged in the WIC work that we have done. And we will continue to look at that with this new grant opportunity, but I don't have any additional statistics to share at this time.
Okay. All right. Any other questions? You can put them in the chat. We do have time, so. Or we might be done early today, who knows? All right. Okay, thank you, Carrie. She said such great information. Thank you. So wonderful. Well, I think if there isn't any questions, we can move to the next slide. And if you do have any, while I'm kind of going through the closing, please just pop them in. We can always go back to them. Thank you again so much for presenting on such important work that you are all doing. And to stay connected with Foundation for Healthy North Dakota, you can follow Healthy NODAC on Facebook, Instagram, Twitter, and Foundation for Healthy North Dakota on LinkedIn. And to join the coalition, you can visit the link to stay aware of future webinars and updates on the foundation. And if you there's another opportunity to scan the QR code and take the evaluation survey before it is sent out. And thank you again for taking the time to be at this webinar today, and look for the follow-up email with the recording and resources. So appreciate it.